Welcome back to the PharmaSpeak podcast, where we help pharmaceutical sales professionals sharpen their English and sales skills. I'm Mark.
And I'm Sarah. Today, we're diving into one of the most powerful tools in sales, building rapport. How do you connect with a doctor and start a great conversation? We'll guide you through 5 key techniques and even practice a role play together.
That's right. And as always, we'll give you, our listeners, a chance to answer some questions along the way. So let's get started. First impressions matter. If you want to build rapport with a doctor, you need to come across as confident, friendly, and approachable. Think about your body language. Stand tall, make eye contact, and smile. Also, how you start the conversation is key. Open-ended questions are a great way to get the doctor talking.
Exactly. Instead of asking, "Do you prescribe this medication?" you could say, "What factors influence your prescribing decisions?" This keeps the conversation flowing. Can you think of an open-ended question you might ask a doctor? Take a moment to say it out loud.
Great. Now, let's move on to the next technique. Finding common ground. People naturally trust and connect with those they have something in common with. If a doctor loves fishing, books, or sports, bring it into the conversation.
For example, let's say the doctor enjoys fishing. You might say, "I heard fishing is one of your favorite pastimes. It must be so relaxing."
Nice one. But remember, it has to be genuine. If you don't really know much about fishing, don't pretend. Instead, you could ask, "What's your favorite fishing spot?"
What's a hobby or interest you could use to find common ground with a doctor? Say your answer out loud.
Great. Another essential skill is active listening. This means really focusing on what the doctor is saying, nodding, making small responses, and asking follow-up questions. And here's a secret weapon: mirroring. This means subtly copying the doctor's body language and tone. If they speak calmly and slowly, match their pace. But be careful, it should feel natural, not robotic. If someone crosses their arms and you do it immediately, it can feel awkward. Instead, wait a few seconds before mirroring. "Can you try mirroring me?" I'll say a sentence, and I want you to repeat it with the same tone and pace. That's a really interesting perspective, doctor.
Great. Now let's put everything together with a role play.
All right, here's the scenario. Imagine you're meeting a doctor for the first time. This doctor is highly experienced, enjoys fishing, reading, and spending time with family. He appreciates punctuality, prefers discussions focused on patient outcomes and clinical benefits rather than marketing, and doesn't like talking about price. I'll take on the role of the doctor, while Sarah will play the sales rep. As you listen, think about how you would respond in this conversation.
Good morning, Dr. Ahmed. It's great to see you. I know you have a busy schedule, so I really appreciate your time today.
Good morning. Let's get started. What brings you in today?
Before we begin, I heard you enjoy fishing. I imagine that must be a great way to relax outside of work.
Yes, I love fishing. It's my way to unwind.
That sounds amazing. I'd love to hear more about it sometime. Now, I wanted to ask, when it comes to choosing a medication, what are the most important factors for you?
For me, patient outcomes always come first. I need to be sure a treatment is truly beneficial.
That makes a lot of sense. In fact, our latest data shows how this treatment is improving patient recovery times. Would you be open to exploring how it might fit into your practice?
That sounds interesting. Tell me more.
Of course. But first, let me ask, what specific challenges do your patients face with current treatments?
Now it's your turn. Imagine you're the sales rep in this scenario. How would you start the conversation?
Pause now and take 10 seconds and try introducing yourself as if you were meeting the doctor.
Awesome. Practicing like this will help you sound more natural and confident in real sales meetings. To sum up, there are 5 key techniques for building strong rapport: making a positive first impression, asking open-ended questions to encourage deeper conversations, finding common ground to create a connection, practicing active listening to show genuine interest, and subtly mirroring body language to build trust and comfort.
And remember, using the right vocabulary and idioms can make your conversations more engaging and natural. For example, you might describe a fresh perspective as a breath of fresh air, acknowledge an insightful comment by saying you hit the nail on the head, or ask for someone's expert opinion by saying, I'd love to pick your brain on this. Incorporating these expressions into your conversations can help you sound more fluent and confident.
Practice using these in your conversations this week. Thanks for joining us today. If you enjoyed this episode, share it with your colleagues and keep practicing. See you next time.
See you soon and happy selling.